Okay, then I went to another one in Western Australia, Cockburn, near just off Perth lah. This is another of my classmates, so it's actually here. This one. It's right in the middle of like this building like that. So it's a huge building. Then it's just one place there. GP special super clinic, and they do a lot of teaching. You see, University of Curtin is actually with them. So they actually park their teaching rooms together. So the GPs during those sessions they make appointments to see them, but actually they teach at the same time. Ours is by the way you sit in like that, you know.
Yeah.
So they are very specialized or very dedicated. Then they do family support services in the same super clinic, which we don't
Family
do.
service center is inside.
Yes, we don't do. So in this setup, it's a bit better because downstairs is already the public service.
Yeah.
So other family medicine center don't have this thing. We have currently we have 9 such clinics, but don't have one that's like this. Actually, ours is quite close to what the Australians are doing. Now you see, they do a lot of things like immunization alliance and all that. So a lot of preventive care, and they have a observation room like a A&E. So patients can just sit there for half a day, set the drip, and then you go home at the end of the day. So you prevent a lot of hospitalization, right? Makes sense, right? In fact, even some of this setup, they are better equipped. They can do even all those IV antibiotics and all that. So they don't have to stay in the hospital. And in UK, this one they don't do as much. In UK, they do pre-op testing also. So for example, if a person go for a certain op, you need to do say treadmill ECG, just to get fitness for op. They can do that also. So this is the Cockburn one.